Assalamu alaikum. I think this is the time we should start our session. Is the screen visible?
Yes, sir.
All right. Okay, good. Okay, let me settle this. All right. Now, thank you very much, everybody, for joining this session. We would have some interactive session, and it would be followed by hands-on activity, and then followed by discussion and maybe some more interaction. Right. So let us start with first about a survey which I conducted 2 years ago in August 2022 on this same platform, the MedEd webinars and workshop platform. And there were 2 questions asked. The first one was, does your institution use essay type questions in summative or professional examination? And the second question was that if the answer to above question is yes, which of the following types of essay questions are used? And you can choose more than one type. And in this survey, we did not define different terms like what is difference between short answer question or short essay question. We just left it for the respondents to use whatever definition they are using. And we got a response from 450 people and from 22 countries. And this was the list of countries from Bangladesh to UAE. So the people responded from these 22 countries. And the respondents were, let's say, majority were at the professor level, 32%. Then 21% associate professors, 20% assistant professors, 10% senior lecturers, and another 7% lecturers. So all the academicians, they almost more than 90% were academicians who responded to the question. And the 86.4%, they said that they are using essay type of question in summative or professional examination. So still a big chunk, a big number of medical schools across the globe, where we have 22 countries participating in this. They are using essay type questions. And the most common was short answer question, then the short essay question, in the structured essay questions and modified essay questions, and patient management problems. So these were the different types of essay type of questions being used by these medical schools. So we know that the number of medical schools are using essay type of question, even though there has been a long-standing debate about the usefulness of essay type of question, more against and less in favor. And as I said, so many medical schools are still using, including Cambridge and Oxford universities in the UK. They are also using these essay type of questions. So aim of this workshop is to help improve the quality of essay questions and their marking schemes. With that background in mind, let's look at the learning outcomes. So participants will be able to explain different types of essay questions. And explain the rationale for using structured essay questions, discuss the advantages and disadvantages of essay type questions, create effective essay tests that will accurately assess their students' achievements, and mark the essay questions more objectively. So these are the 5 objectives or 5 learning outcomes which we will, inshallah, try to achieve during this session. Let's look at the definition of essay question first. And see, this is a very old definition, 1951. And so essay question is a test item which requires a response composed by the examinee, usually in the form of 1 or more sentences. So this is the first part of the definition, that the examinees have to answer in the form of sentences. So response composed by the examinee, usually in the form of 1 or more sentences. So they have to write the response rather than choose the response. The second part is of a nature that no single response or pattern of responses can be listed as correct. Now, so this means that this definition is mainly related to about the opinions, discussions, where there are no sort of single correct answers. So that is the second part of this definition. And the accuracy and quality of which can be judged subjectively only by one skilled or informed in the subject. And this is the third component of this definition, that there is a lot of subjectivity and only selected people can assess these kind of questions. If we further break it into this definition break into different parts, requires examinees to compose rather than select their response, elicit responses that must consist of 1 or more sentences. No single response or response pattern is correct, means opinions, discussions, debate, pros and cons, ethical issues, etc. The accuracy and quality of student response to essay must be judged subjectively by a competent specialist in the subject. So there's a lot of subjectivity in the assessment. As I said, this is an old definition, 1951, and there has a lot of changes taken place after that. And the reason I presented this definition first was to see how the things have changed over the years. Now, this is the current definition. So first, essay question itself. Essay question consists of a statement, often several sentences long, that describes a situation or poses a problem. So essay question itself may be few lines or few statements, and usually they would describe a situation, they would pose a problem. And the student's task is to write an essay to answer the problem posed. The answer may be as short as a paragraph or may cover several pages. Responses have to be correct and can be marked objectively. You can see that how much difference between the two definitions is. Here, the old definition says that there may not be a single correct answer, but the type of essay questions we are talking now, they must have a correct answer, and they should not be marked subjectively, but objectively. Means that we construct the questions in such a way and prepare marking scheme in such a way that the subjectivity is taken care of and the responses are scored objectively. So this is the definition, the modern definition, and this is what we are doing presently in our essay type of questions. So some other definitions: essay type questions requiring the candidate to generate an answer rather than select. Such questions effectively shift the focus of assessment from knowledge of isolated facts to the use of basic science principles to solve the problems. This is a big attribute, a big property or big strength of these essay type of questions, that they focus on application of knowledge, and the examinees are supposed to solve the problem rather than simply recall of information. So we have moved from recall of information to the application of information, and that is best assessed by using essay type questions. So broadly speaking, there are two types of essay type questions. One is extended response, open-ended, which is a classical form of essay type of questions. And second is the restricted response or modified type of questions. I'll explain a bit more about these two types. So extended response or classical is I think, is kind of essay questions which I faced during my training years. These type of questions have greater freedom of response, open-ended, so a student can write a lot of things. It involves a number of learning outcomes, and they are broad in nature. And because they are so broad in nature, it's difficult to relate the question to the intended learning outcomes and to indicate the nature of desired answer. In fact, it is usually very difficult to write a model answer for such questions. Here is an example. Evaluate the effects of food shortage on the stability of the political system. Now, it's such a broad topic that we don't know what culture we are talking about, what nation we are talking about, how long the answer is expected, maybe a paragraph, a page, even a whole book can be written on this. Evaluation of effects of food shortage on the stability of political system. Are we supposed to give our opinion? Are we supposed to give our historical facts? So this is classical example of extended response question where they are broad, are difficult to relate to the outcome, and very difficult to write a model answer. On the other hand, the restricted response questions are modified. They are highly structured. They are focused. They relate easily to specific learning outcomes. Intent of the question can be communicated clearly, easy to write a model answer, and they can be marked easily. So this is an important slide, and some important attributes of a restricted response questions. And these are type of essay questions which we are using nowadays and promoting these restricted response questions with these attributes: highly structured, focused, easy to relate to learning outcomes, intent can be communicated clearly, easy to write a model answer, and marked easily means objectively. So here I'll further explain this concept by using some example. Look at this question. Discuss various methods to increase the production of food in Malaysia. Various methods to increase the production of food in Malaysia. This is an example of an extended response. If we further improve on that, describe various methods to increase the production of rice in Malaysia. So from the broad term of food, we have narrowed down it to the rice. And if we further improve, list 5 methods to increase the production of rice in Malaysia. Describe each method in a paragraph. So this would be a restricted response question. So you see that how we can move from an extended response to a restricted response or modified. Now this is highly structured and this is focused. The learning outcome is clearly stated. Students exactly know what they are supposed to do. And based on this, the question, a model answer can be written and the question can be marked objectively. So this is how we have moved from extended response to the restricted response questions. Now, let's look at the different types of restricted response essay questions. One is short essay question. Other is a short answer question. One is essay and other is answer, short answer questions, modified essay questions, patient management problems. Basically, modified essay question and patient management problems, they are almost similar, with only the name is different. Now, here would be a question some people raise, whether short answer question or SAQ is really an essay question, because here this type of essay questions do not fulfill the definition of the essay question, where the response has to be in the form of sentences or a paragraph. So our short answer question, a type of essay question, we will look into it shortly. So let's talk about the short answer questions first. And here is an example. Abu, a 14-month-old boy, was admitted to the pediatric ward of Slayang Hospital with the complaints of diarrhea and vomiting of 3 days duration. So this is the presenting complaint. On examination, he was drowsy and irritable. His skin turgor was poor, eyes were sunken, anterior fontanelle was depressed, and mucous membranes were dry. His pulse was 130 beats per minute, weak but regular. Respiration was deep with a rate of 50 breaths per minute, and capillary refill time was 4 seconds. So we have given a full scenario, the presenting complaint and examination findings. And the question is, estimate the degree of dehydration in this patient, and answer would be only 2 words, severe dehydration. This is short answer question because the answer is short. So this, many people question or raise objection whether this kind of questions can be called short answer, the essay type questions or not. We generally don't recommend these kind of questions, because the short answer does not really tell you whether student knows what is going on, and such a short answer may be even whispered to a student. However, we can convert this short answer question into a short essay question. So the short answer questions, in this type of question, the scenario is long, as we have just seen, up to a paragraph, but answer usually consists of few words or a sentence. These questions are most useful to assess the student's ability to make a diagnosis or differential diagnosis based on clinical scenarios, or interpretation of laboratory results, and making decisions in emergency situations. Here, for example, the diagnosis based on clinical scenario may be only bronchiolitis. Interpretation of result of CSF, the answer may be only bacterial meningitis. Managing a patient with acute respiratory distress due to upper respiratory obstruction, the answer may only be tracheostomy. So these are examples of short answer questions where the scenario itself is quite long, but answer is usually very short. Now, that is the short answer question. Now, let's look at the short essay question. We use the same example which we use in the short essay question. We have given the presenting complaint and we have given the examination findings exactly the same. But now the question is, estimate the degree of dehydration in this patient and justify your answer by giving reasons based on the findings provided in the case. So in this case, student has to give an answer, let's say severe dehydration, but he or she has to justify the answer by picking up points from the scenario itself. So this is how the short answer question can be easily converted into short essay questions. And this is a much better form of questions because it not only covers what is expected in short answer question, but it goes a step further and it assesses the students' analytic abilities and their ability to defend their answer based on the facts stated in the situation. Another example, Kamal, a 7-year-old boy, is brought with decreased appetite and vomiting associated with diffuse abdominal pain for 1 day. On examination, he appears confused and disoriented. He has rapid and labored breathing with acetone odor or fruity smell. His mucous membranes are dry. His heart rate is 105 per minute and systolic blood pressure is 75 millimeter of mercury, and he is suspected to have diabetic ketoacidosis. Now, you see, we have given the presenting complaint, we have given the examination finding, and we have given a suspected diagnosis, which is diabetic ketoacidosis. And based on this, we can ask multiple questions to the students. The first question may be, state 5 questions you would ask in the history to support the diagnosis of ketoacidosis in this patient. So some information is already given. So student has to look for additional information, and that information should be either to support or rule out the diagnosis of ketoacidosis. Second question, list 4 initial investigations you would request in this patient, giving 1 reason for each. So they have to not only name the investigation, but they have to justify why they are asking that investigation. Third question, describe the mechanism of acetone breath odor in this patient. And the fourth question, briefly explain the 5 principles of immediate management of this patient. So this is a classical example of short essay questions where we give a scenario which may include the presenting complaints and examination findings. And on that, we prepare multiple questions. In this format, actually, we can have integrated kind of questions based, let's say some questions may be related to, for example, in anatomy, another may be related to physiology or pathogenesis, pathology, so management. So there could be multiple avenues for assessment of students in such short essay questions, and they are very useful if we are using an integrated curriculum. So here is for the model answer for the one we just gone through. So you see the marks are also given. So list of questions, but it's not that we would accept only these answers. We can accept many other answers as long as that make a sense. Then similarly, the investigations and their reasons. So again, if a student give another investigation, which is not in our list, but that list, that investigation is relevant and reason is given properly, so we can include in that. So for when we prepare this kind of short essay question, we have to prepare this kind of model answer, so that examiners can mark those papers following these guidelines. And because every person who is marking this paper is using these guidelines, so we can cover the element of subjectivity quite adequately in such questions. Talking more about essay, the short essay questions. In this type of question, the scenario is short, but answer is long. Usually, as I said earlier, in short answer question, the question is long and answer is short. But in this case, we can have a shorter scenario, but we can have multiple questions. And these questions are most useful to assess students' knowledge in relation to pathophysiology of a condition. For example, mechanism of jaundice in a patient with malaria, making a diagnosis with its justification, planning detailed management of a patient in acute and chronic conditions. So these are situations where short essay questions can be very, very useful for assessment of students objectively. Right, now let's talk about the next type, which is modified essay questions. And I have sent the one example to you in our WhatsApp group. Can you open that and then we can go through that together, or I can try to project it here. Yeah, here. Right. So this is can you see the screen?
Yes.
Yes.
Yeah.
Yes, sir.
Right. So now modified essay question is usually consists of multiple parts, maybe 3 to 5 parts, and they start with the scenario. Let's say this is the part 1. Again, I give an example that a 10-month-old boy is admitted to the pediatric ward with complaints of fever, excessive crying, and vomiting for 2 days duration. So we give the whole story, and then we give the positive findings, and then we ask the questions. State the most likely cause of cyanosis in this in the fit which developed this patient. List 3 differential diagnoses for his condition, and list 4 relevant investigation you would request to arrive at a diagnosis. So this is part 1. Scenario, physical findings given here, and then the questions asked. Then we move on to part 2, where because students, once they submitted the answers to part 1, they would not have access to that part anymore. So in part 2, we would give the summary of the previous scenario. And here we have added some investigations. And then we, for example, here we say that we have done the lumbar puncture of this patient. And then we ask questions, list 3 precautions that should be taken before performing lumbar puncture. Based on the findings, state the most likely diagnosis. So means that they have to interpret these laboratory results and write the most likely diagnosis. So once students have answered this, again, they submit this and they go on to part 2. And now based on, we reveal the diagnosis here, that based on the clinical and investigation results, he is diagnosed to have bacterial meningoencephalitis and outline 4 principles of management for his condition. And again, list 3 complications for which you would monitor this patient during follow-up. So this is an example of modified essay question, which is has multiple parts. I'll go into explain this in a bit more detail so that we can understand what this is actually, what type of this question is, and how it is different from other types of question which we were just talking about. So let me go back to that slide. Can you see this slide, the screen?
Yes, sir.
Right.
Yes, sir. Yes,
yeah,
can
the
see.
types of essay. Okay. Now, when we we have seen this modified essay question. These types of questions portray the real life situations in clinical practice and are useful to assess students' knowledge in clinical conditions which cannot be presented in clinical examination. So this is one strength, that the clinical cases which we cannot examine, either patients are too sick or the conditions are relatively rare, but they are very important and we must assess that, but they cannot be assessed in the long case or short case, then modified essay question is the best format to assess those kind of conditions. For example, a patient with coma or a patient with status epilepticus, etc. Obviously, we cannot have in the clinical examination. So MEQ is a good way to assess these conditions which are clinically important, but we cannot include in our clinical examination because of the limitation. So that is one big justification for using modified essay questions. So they are designed to evaluate a candidate's problem solving and decision making skills in a clinical context. And again, this is the second important attributes, that modified essay question look at the ability of the students to solve the problem and make appropriate decisions. The key features of modified essay questions include they are case-based, they are clinical scenarios. In fact, when we want to prepare these cases, it is best to take a case from the hospital, the real patient, and then modify it a little bit here and there, and so that bring it at the student level, and that can be used as a clinical scenario or case-based. So MEQs present a clinical case in stages. There is a progressive revealing of information which simulates the real life patient management. Like in hospital, we see the patient, we take the history, we perform the physical examination, then we send the investigation, get the results, etc. So MEQ exactly follows what happens in real life clinical practice in our hospitals. Second, there is a sequential questions that each stage of revealing the information, the specific questions are asked, relevant questions are asked about the information which has been presented. Each stage of the case includes specific questions that require the candidates to apply their knowledge and reasoning to progress through the scenario. Third attribute of modified essay question is that their focus is on application rather than recall of knowledge. Unlike traditional essay questions that may test the recall of facts, the modified essay questions emphasize the application of knowledge to practical situations. And this method reduces examiners' variability in marking, improve content reliability, and increase the validity of the assessment. Modified essay questions have multiple consecutive parts, as we have seen in that example, which sequentially reveal the additional information about the patient, and questions are framed accordingly. This is again like a format we use in CPCs. Once answered, the candidate cannot access the part again. For example, the first part may relate to history taking. The second part may relate to interpretation of findings of physical examination and laboratory results. And third part may assess the ability to manage the patient, including prevention in the individual as well as in the community. So there could be different formats or the sequences. This is the most common one which we use in our modified essay questions. Right, so having gone through these different types of essay questions, including short answer questions, short essay questions, and modified essay questions, let us look at the strengths and the weaknesses of essay questions and how to address that. First, the strengths. Essay questions are effective way to measure higher level of cognitive thinking, analysis, evaluation, synthesis. If you look at the Bloom's taxonomy, the higher levels of Bloom taxonomy are best assessed by essay type of questions rather than multiple choice type of questions. Students are required to explain complex ideas and identify relationships rather than just list the memorized facts. Essay questions present a more realistic task for the students by organizing and communicating their thoughts. And essay questions are less time-consuming to construct as compared to the objective type of questions. Essay questions enable teachers to judge students' abilities to organize, integrate, comprehend, and interpret materials and express themselves in their own words. Essay questions can also test the writing skills of students. So those were the main strengths of essay questions. Looking at their weaknesses, essay questions cover less content because of the time constraint, because the let's say a modified essay question can be from 20 to 30 minutes. So because it takes longer time, so only the less content can be assessed. Essay questions require more time to mark because these questions would be marked manually and not by the computer. So it takes a lot of effort to mark these questions. And while grading essay questions, personal biases can affect the grades assigned. So there could be number of issues related to marking of these questions. There could be a debate that how to choose the topic, what is the criteria, what topics should be taken for it. I think the blueprinting can address these concerns. Reliability, because the sample size is small only few topics can be assessed if we are doing only essay type of question. So that compromises the reliability. Right. So this is about the benefits and the challenges which we may face if we are using the essay type of question. Now, here are some, let's say, the tips, a kind of tips how to prepare good essay questions. First, the preliminary preparation. The first step is match objectives of the test or exam, maybe based on Bloom's taxonomy, and best method to achieve those objectives. If you simply want to test the recall, then probably multiple choice questions is the best way, especially the true false type. If we want to assess the comprehension, then single best answer questions and essay questions are the right method. Application of knowledge or interpretation, again, single best answer questions and essay type of questions. Analysis, best answer questions and essay type of questions. Evaluation, essay type of questions. Synthesis, essay type of questions. Now, based on our objective or what we really want to assess, we have to choose the appropriate assessment method. So we have to match with different types of questions. So the second step would be list the content and areas to be tested in the examination, means the blueprinting, and from that content, identify the topics that can be best tested by using essay type of questions. As we know that a single method of assessment is never inadequate. We have to have a number of different assessment methods. Some of the areas can be easily tested or more appropriately tested by multiple choice type of questions, where others are best tested by the essay type of questions. So we have to differentiate, and the topics which can be easily assessed by multiple choice questions and those which are best assessed by essay type of questions. We can have a short meeting and discuss with the colleagues and decide about that. So that is the preliminary preparation. Another way could be that first plan the content to be tested in the examination. So prepare a blueprint, and from that blueprint, identify the content that can be best tested by using essay type of question. And based on that, you identify the objectives. Although this is not the best method to do that, we should identify the objective first and then the essay type of question. But sometimes in this situation, we might have to do this reverse method of solving this problem. Then before we begin to create essay question, let's ask ourselves some crucial questions. Number one, what kind of information do we want in the answer? Do we want to inquire for facts, or do we want inferences and applications? Most students truly want to provide the answers the examiner desires, and they will do so if we ask carefully worded questions. Means that if our questions are clearly stated, we have used the right words, right verbs, that they will help the students to answer the question adequately in the way we want them to answer, or the information we are looking for, because the structure of question can change the whole thing. The way the student understand the question, they would write the answer accordingly. Clearly defining the content and purpose of an essay question is important to make decision regarding test construction, item formats, and other key steps to ensure the resulting scores provide meaningful information. Now, this is an important statement. Looking at the score of the student, we should be able to interpret that. It doesn't mean only pass and fail, but the scores must make sense. Let's say whether scores can tell us that the student can solve a novel problem effectively. Our student is good at recalling the information. So what it means that the scores student give not only decide pass or fail, but also their abilities. Let's say if student is scoring well in an MEQ, that might tell us that this student has ability to solve a problem, make important decisions. So scores should be used to identify the students' strengths and weaknesses so that we can give an appropriate feedback. So the marks are more than just pass or fail information, but they should provide us the deeper information about the student. Objectives of asking questions, here are some examples. We may be asking for critical appraisal, relevance of information, correctness of a concept, idea or an information, identification of problems, reorganization of facts or facts versus fallacies, explanation of concept or events, evaluation and or synthesis, inferential thinking, pros and cons, and comparing two approaches or methods. So these are different kind of objectives which we can use in essay type of questions. And these objectives can only be assessed effectively and efficiently in essay type of questions and not in multiple type choice type of questions. Some rules of constructing essay questions. Number one, use essay questions to measure complex learning outcomes only. So avoid asking essay questions that require factual recall, because factual knowledge can be measured easily through other formats which are more effective and more appropriate and cost effective. So the factual recall should not be assessed by using essay type of questions. Relate the questions directly to the learning outcomes being measured. Clearly stated questions not only make essay question easier for students to answer, but also make them easier for instructors to mark. So this means that when these questions are constructed during the vetting session, we have to see that the questions are written properly and they have used the right verbs. For example, saying that what is the value of studying science fiction? If we stop there, it doesn't tell much to the student what we are really asking for. But if we add, elaborate your answer by using 3 examples, that gives a lot of guidance to the student to answer that question, and that can make a basis for marking the question as well. So whole question would be, what is the value of studying science fiction? Elaborate your answer by using 3 examples. Another example is describe 4 advantages of MCQs over essay questions. So here we see that the questions directly are related to learning outcomes, which we are trying to measure, and that helps both in to students in answering the question and to examiners for marking the question. Third, formulate the question so that the task is clearly defined for the student. So student must know clearly what they are supposed to do. So indicate the scope and direction of answer. For example, give 3 reasons for or discuss the steps, how you will do this procedure, etc. Fourth, do not permit choice of question unless the learning outcome requires it. Um, so avoid giving students the option to answer a select number of questions from an entire list. I'm not sure whether this is still happening, but when we were in medical schools, let's say the paper would have 5 questions and we can choose any 4. So the recommendation is that this kind of choice should not be there. Avoid giving students the option to answer a select number of questions from an entire list, because this makes the test different. And in order for testing to be fair, the students must perform the same task. And this also compromises the reliability. So the whatever questions are there in the paper, all students should answer all those questions. Use relatively large number of short restricted response questions rather than few long or extended response of questions, because by using restricted response question, we can cover more content. They are more specific, they are easy to score. However, by doing that, we would have less assessment of the abilities to integrate, organize, or explain. So here in our medical schools, we are using a mixture. We have single best answer questions. We have restricted response question, mainly the short essay questions, and we use modified essay questions. So having these 3 types of written assessment gives us an opportunity to assess the students' capabilities over a wide range of areas. Assign marks for correct response. Indicate how many marks are assigned for each correct response. Students may have to choose what questions to answer when the time is running out. So for every question, the marks should be indicated, and develop a scoring key before administering the test. So identify the answers which would not carry any marks. So here is one is that when we are constructing the question, at the same time, we should prepare the marking scheme, model answer and marking scheme. And sometimes we might have to identify that which are the marks which should not be given, which are the responses, or what kind of responses should not be given any marks. Here is an example, and like here we say that this is the differential diagnosis, but if student writes brain abscess or space occupying lesion or febrile fits, they should not be given any marks, because these conditions are completely out from the scenario provided. So not only we can indicate the answers which should be awarded, we can also sometimes identify the responses which should not be given any marks. Provide ample time for answering, and suggest a time limit for each question, especially in modified essay question. Each part is given an estimated time, so students know that they have to move on to the next part. And obviously, when we are estimating the time, we should give time for thinking and writing and organizing, and not simply recall. The question is that is there any harm in giving a little bit extra time? Normally, we would announce in the examination time, stop writing, put your let's say writing a pen or pencil on the table, and hand over the paper immediately. But is there any harm if given a student needs another 1 or 2 minutes to complete the answer? The next is use essay questions to measure knowledge. Use essay questions to measure application of knowledge and reasoning ability and not opinions, because we are talking about the science-based areas. The opinions may be important in other fields, but in science-based areas, if we are using essay type of questions, then we are not asking for opinions, but we are asking for correct answers and reasoning. So that in this way, the science-based essay questions become different than the other fields. Essay questions may have more than one correct answer. So formulate questions to get the desired correct answer. So this is the skill of the person who is preparing the question to frame the question such a way that the desired answer we can get from the students. So there shouldn't be any ambiguity in the question. Improve the essay questions through preview and review. Again, a very important part of vetting the question. Preview, predict student responses, write a model answer, and ask a colleague to critically review the question, the model answer, and the intended learning outcome. This is an important exercise. We may realize very quickly that what we are writing in the model answer is not really being asked in the question. So in this way, either we have to modify the question or modify the model answer, but this is a very good practice, that going through the model answer and see whether that is really what is expected in response to this particular question. So, and then we review after students have answered the question, and review student response to the question. And sometimes we have to modify our model answer by looking at the response of the students. If they have given genuine or reasonable answers, which we could not think beforehand, but they are acceptable. So those answers should be included in the model answer. Right, so once we have prepared an essay question, there is a quick checklist we should use to assess the question. First, could the item be better assessed with a different kind of assessment? So we have to see that the essay type of question is the best way to assess that area. If not, it should be assessed by other methods. Is the essay question aligned with the intended learning outcomes? Is the essay question too long and should be rather split into several relatively short essay questions? Is the question worded and structured in such a way that it will be clear to the students what they are expected to do? In other words, there is no ambiguity in the question. Is the task presented to the students reasonable? If the question is for year 1 students, so is the task appropriate for their level of training? Is there a problem situation included in the essay question? And is it a novel situation? So generally, we in essay type of questions, we would include a kind of problem which we may not have addressed directly in our teaching, but the principles and the would be the same, which, let's say we have taught an example of a problem in the classroom. So, but in question, we use another situation, but using the same principles for managing. Do the students know the recommended time for completing their answer? As I mentioned, it's important that students should know how much time is there for them to answer that question. Do the students know how many marks the essay is worth? And they have you avoided the use of optional questions. Have you written a model answer for an outline of major points that should be included in the answer? Writing a model answer is must. As soon as we write a question, we must write a model answer as well. Do you have a person knowledgeable in the subject critically review the essay? That is what we were talking about, the preview, that in the vetting session, some other people should look at the question and uh, try to improve it. So that is covering the different aspects of essay type of questions, their classification, their strengths, their weaknesses, and what are the principles that should be used, and what are the tips which can help in improving these questions. Now we will be moving on to hands-on activity, but if there are any questions, first we will discuss that. Yes, any questions, please?
Sir, my question is that what is the difference between MCQs and best single answer questions?
MCQs
and BAQs, best answer questions.
So actually, the multiple choice questions have different types. So one is true false type, which is not being used anymore. Then there is a single best answer question, or BAQ, where the scenario is given and there are 4 or 5 options. All of them are correct, but one of them is most appropriate. That is a BAQ, best answer question, or single best answer question. And then there is a extended matching questions. So these are different types of multiple type of questions.
So BAQ is a type of MCQ.
That's right. That's right. Yeah, BAQ is a type of multiple choice questions.
Thank you.
Yeah. So any other questions, please?
Yes, please. I have a question concerning the modified essay question.
Right.
You had said that it is formed of different parts, and the student finishes one part and does not go back to it.
That's right.
So this is not applicable to written exams. Is this related to like electronic exams?
No, it can be done both ways. We are doing manually. Let's say there are 3 parts of the modified essay questions. Each part is on a different page, and usually we use different colors as well. And so the student is provided these parts in an envelope, and they are allowed to take only one part at a time. They answer on that paper, and then they deposit that answer sheet into another envelope or a basket. The reason they cannot go back, because the subsequent part of MEQ would answer some of the previous questions.
Yes.
So this is done by manually. It can be done electronically as well, because after answering the question, there is a submit button. So once students submit, they cannot
go back,
access that part again. So it is being done both manually and electronically. In our institution, we are doing manually. So
yes, in our institution as well, we don't have electronic exams, so that's why I'm asking if it's
it can be quite easily done manually as well. You need just little bit clarification. And you see, let's say there are 3 parts. We purposely use different color for each part, and we advise students that there should not be more than one color on your table. And that is also helpful for invigilators, that from a distance they can see if student has 2 different colors. And so because the time is already estimated, time is given, so student would answer, and then they put answer sheet into an envelope or a basket on the side, usually maybe lying on the floor, so they cannot access that part anymore. So
Okay.
we have been doing for many years, and quite experienced in doing that.
Okay, thank you.
Yes. Any other question?
Yes, sir. This is me, Dr. Kabir, sir. Thank you for your nice explanation. Sir, is there any standardized idea or any description that how many segments should be in MEQ, part 1, part 2, part 3? Usually we in our institute we do 3 part, but previously also I saw some using part 1, part 2, part 3, part 4. But is there any standard?
So actually, Prof. Kabir, the standard is the time. So
Okay.
MEQ should, you see, when we started, it was 45 minutes. But then
Okay.
we realized that it is difficult to fill 45 minutes, and then people start asking very trivial, minor questions to fulfill the time. Then we realized that half an hour is the best. So we have 30 minutes, and if we can have 4 parts or even 5 parts, but it should be within those 30 minutes. So limit is the time, not the parts, that how many it should be. That is the real definition of an MEQ. I know that some institutions, they have limited that they want only 3 parts or 4 parts, but actual limitation is the time, not the number of parts.
Yeah. Secondly, sir, that in the questions that usually we started with the history, then we go for physical examination, then we ask for investigation, then the treatment and complication for year 5.
Right.
So if in the questions that some ask that pick out the from the scenario the physical sign and what is the importance of this, or instead of this, if I just put that under the following headline, describe the significance of the clinical findings. Suppose in the scenario, it's a case of anasarca or lower limb bilateral pitting lower limb edema. So keeping the diagnosis CCF, CKD, cirrhosis, if I put there is on examination we found there is JBP, tender hepatomegaly, but there was no jaundice, and there is no any history of problem in urine like oliguria or anuria. So if the renal angle was not tender. So if I just put under the following headlines, what is the significance of no absence of jaundice, presence of EKD? Is it okay? Because in the written some raise question that let the student pick up and describe.
No, if you have given the information in the scenario, whatever you were just saying, that if you have given the information in the scenario and scenario says there is no jaundice, then obviously you can ask the questions that what is the significance or of this finding and examination. Yes, actually, when we go through different example, you would see that we do ask. For example, in that question, I was asking that the child developed cyanosis during the fit. So, what is the mechanism of developing cyanosis during the fit? Yes, that's very much acceptable.
Okay, thank you, sir.
Only thing is the way we put it.
Okay, sir. Thank you, sir.
Right. Any other questions, please?
Sir, this is Saad from Pakistan.
Right.
Sir, I just wanted to ask, sir, the form of MEQs that you have shown for essay type question,
Right.
it's more or less like an F type question being given in the form of MCQs or extended MCQs, in which there is a set in which the student does that and then the set changes and he cannot go back to it.
Right.
It is more or less like the F type questions which we analyze in MCQs, which we give it in MCQs.
Right.
So-
Actually, yeah. Sorry. Yeah. Yeah. Keep on. Yes. Yeah.
So just wanted to ask whether these MEQs can be converted to the F type and given to the students in an extended matching question type or something of that sort.
Right. They actually, if you see when I started talking about MEQ, the type of the topics we use in MEQs are the clinical cases, which are important, which we think student must be assessed, but somehow we cannot assess in our clinical examination. That's number one. Number two, throughout that MEQ, we are talking about the same patient. We are not changing the patient. We are having the same scenario, but we are giving additional information along the way. So this exactly follows what we do in our, let's say, clinical practice, that we have the history and then we get the examination findings and the investigation and management and prevention, etc. So we follow exactly the same. And yes, the students are not given access to those parts again, because, for example, in last part, when we want to ask about the management, we must establish the diagnosis first. If we do not establish the diagnosis, we cannot ask the management. So that's why because the answers are being provided in subsequent pages, students are not allowed to go back. As long as the continuity is there and it's about a clinical condition which is important to assess, if that condition is being fulfilled, we can give it any name, that doesn't matter. I hope that answered your question.
Sir, I was saying that instead of essay type in which the student writes his or her opinion on that particular question,
Right.
can't we do the same in extended matching questions in a form of extended matching question or an MCQ or best answers?
So yes, in extended matching question or others, student would choose the choice you have given. You wouldn't know what actually students are thinking, because they have to choose only, you have given 4 or 5 options and they have to choose from that option. That does not assess the thinking skills of the student, the decision making skills. Now here we are giving a scenario and asking students to decide. But if after giving the scenario, we are giving our decision and asking the students to choose, so actually we are providing them an opportunity to guess as well. Or somebody can let's say whisper from somewhere that option C is the right answer. So there is, we are not really assessing their critical thinking. We are not assessing their decision-making abilities. We are not assessing their reasoning, because we have just given the answer and students have to choose. Some of them may choose it rightly. And on top of that, even if they have chosen the right response, they may not really know the details behind that. Let's say they may choose a right answer, but if you ask them, why did you choose that answer? What is the reasoning? What is the thinking? They may not know that. So MEQ or essay type of question go beyond that and really assess the student's ability and their reasoning skills and the sort of justification and discussion. So it's that's why I said the higher levels of Bloom's taxonomy. For example, analysis, synthesis, you cannot assess these levels of Bloom's taxonomy in multiple choice questions.
Sir, I need to ask a question,
Right.
sir.
Yeah.
With regard to the designing of the marking key,
Right.
is there any evidence that the process-based rubrics, are they any better or worse then the marks allocation rubric that you just
Right.
showed us, and having a model answer, one model answer or multiple model answer, like for poor performance, for an average performance, and for an excellent performance. Do we have evidence that which is the preferred practice?
Dr. Aisha, my second component of this discussion is on that topic. The writing the model answers, writing schemes, and using rubrics. I think we will discuss that. My second component is on that after our hands-on activity.
And so one comment about multiple choice questions that I see very frequently,
Right.
that the problem of even for recall, there's a lot of recognition in MCQs.
Right.
And the problem of recall, we can solve this with short answer questions. So the same questions that can be given as MCQs, at that same level, they can be given as AQs as well. But
Right.
then you can be sure that the student is recalling and not recognizing.
Right. Yeah. As I said, the purpose of whole this exercise is to go beyond or what is happening in the background, why student is choosing that answer, what is the thinking, or what is going through the mind of the student. That's the ability which essay type questions have on multiple choice type of question. It's not only the answer, it is the process behind the answer which we are trying to look at the essay type of questions. Right? Any other questions?
Sir, I have one questions.
Yes.
So for the integrated curriculums,
Right.
if let's say there is a mix between SAQ and SEQ type of question, because I think like for anatomy, they will have more towards the SAQ type of questions.
Right.
And rather than physiology, they need SEQ type of questions.
Right.
So even in the case of there is a mixture between this SAQ and ECQ, so what we call this kind of essay type questions?
Yeah, actually, yeah, that's interesting, because if you are following an integrated curriculum, you can have one scenario, and because one scenario can have multiple questions, so you can have some physiology questions and some anatomy question. So that would be, let's say, because anatomy is mainly looking at the facts, so you are right that they would go more for SAQ type rather than SEQ type, but we can have mixture in that situation. So we have one scenario, and we have questions related to physiology, anatomy, and biochemistry, maybe pathology and pharmacology, that reflects the integration of the curriculum. You see, the question is that if we have to choose the best way of assessment, if in a particular situation SAQ is the best way of assessing that, so why not? So, but I think it would be interesting to have a scenario and having them multiple questions coming from different disciplines.
Yes, sir. But the thing is, we do have two separate exam. One is based on SAQ, which separate all the subjects, and then the MEQ for integrating all the subjects in one questions.
Right.
So the thing is in the SAQ, because the nature of the subject, making that listing and elaborating, but it's in one paper. So we have a mix of SAQ and SEQ. So that one is the thing that I can see that the difference in the case of integrated curriculum. But for the one that we integrate in one STEM scenario, we did that where we mix between like 3 subjects in one questions. So we call it currently is MEQ.
Right. Yeah. The MEQ by definition is the multiple parts, and with sequential revealing of information. So that's what's the standard definition, but you may use any other name or this name, but I think if you are assessing multiple disciplines in one way, that is, name doesn't matter, but as long as you are achieving that that objective.
All right. Okay. Thank you.
Okay. Right.
Sir, can I ask another question, sir?
Yeah. Yes, please.
So we mentioned in our discussion that the questions should not be based on opinion. But in questions that are assessing ethics and professionalism, we do ask for their opinion, and we
Yes.
ask them to
Yeah,
base it on the reference on which they base their opinion.
I think there I should say that is exception. Yes, because in ethics, for example, sometimes there is no one acceptable answer. There may be multiple acceptable answers. Yes, in questions where we are talking about ethics, you are absolutely right. Then the opinions come. But when we are talking about these science subjects, then I think is rather than opinion, it's more of you applying the information. But you are absolutely right. In ethics type of questions, yes, there may be opinions as well. Right? Any other questions? Okay, now what I'm going to do is I divide the participants into let's say 3 groups, and then I'll send the let me share that and show you what we are going to do. Can you see the screen? Is screen visible?
No, sir, not.
Right,
If you
okay.
are projecting something, then no.
Right. Oh, I need to share again. Yes. Okay. Can you see it now?
Yes, sir.
Right. Okay. Now, what we are going to do next is that I'll divide the participant into 3 groups. So there would be 3 breakout rooms, and then I will send the task through the WhatsApp. So it's a file which everybody would receive. Then you would have 30 minutes for completing the task, and each group should identify a spokesperson for the group for presentation, and then it would be followed by discussion for another 30 minutes. And then if we have time, we will talk about the model answer and marking schemes rubrics as well. Right, so although I'll be sending through WhatsApp, but just going through the tasks here as well. In room 1, the participant would construct a short essay question. The scenario should be followed by 4 questions, and please write the model answer for each question as well. In room 2, the participants would construct part 1 of a modified essay question. The scenario should be followed by at least 2 questions, and please write the model answer for each question as well. In room 3, I'm providing the part 1 of modified essay question, and the participants, based on the part 1, would construct part 2 of the MEQ. And all this information I'm sending in the WhatsApp group as well, so that everybody would have access. Right, now, right, everybody is back.
Yes.
All right, now I hope you had a good discussion. Now we will go from room 1 to room 2 to room 3. So I hope you have chosen your spokesperson who would present. So, and you can actually share the screen. So who is the spokesperson for room 1?
I
Sorry,
think that was by default, Dr. Kabir.
Dr. Kabir, yes.
if they allow me, if they
Oh, they,
select me in the
Permission
election.
granted.
yeah,
Permission granted.
they have elected you. So you
We
can,
had fight.
yeah.
Thanks. We had fight in our conversation, but still there. It's my pleasure that they have been elected me. Okay. Should I
Yeah, you
share
can
it,
share
sir?
the screen. Share the screen, please.
Yeah, okay, sir. Just give me a moment.
Everybody can open your video camera so you can take participation in the discussion.
Is it okay, sir? Can everybody see, sir?
Yeah, I can see, everybody can see the screen.
Yes.
All right, good.
Okay, we have been assigned for SCQ, short essay question. To me, the challenging was that only limited to 4 questions. Okay, so we targeted the marks 20 for one SCQ questions. Though there was no direct dictation, it should be 20 marks. But since we are used to it 20 marks, then we targeted. So 4 questions, providing 4 questions calculated with 20 marks was challenging for us. So it is a question of diabetes mellitus complicated with diabetes ketoacidosis. A 55-year, are you hearing me? Is it okay? Clear?
Yes, yes, yeah.
Okay, 25 years old man with the history of type 1 diabetes presents with severe weakness, lethargy, vomiting, and epigastric pain. He feels feverish, has shortness of breath, and giddiness for the past 3 days. On physical examination, his blood pressure is 90/55, that is hypertension. Pulse rate is tachypneic with low volume, tachycardia with low volume, and respiratory rate is 28 breaths tachypnea with fruity odor in breath. Temperature was raised, and room temperature, room air saturation is normal. So bedside capillary glucose level is 50 millimole per liter. Should I proceed, or any question on
Yeah, you
on
go
the scenario?
through it first, then we'll see. Yeah.
Okay, then first question was state the provisional diagnosis, 2 marks. My mate will discuss why I grade 2 marks given program. Then state the mechanism of the following conditions. Actually, signs, following signs in this patient: low volume, rapid pulse, hypotension, and the fruity odor in the breath, shortness of breath. So see, the low volume tachycardia was due to hypovolemia or dehydration. Hypotension was due to hypovolemia. And fruity odor is acetone breath. Shortness of breath is Kussmaul breathing due to metabolic or diabetic ketoacidosis. State 2 specific blood investigation for the confirmation of the diagnosis. So one is ABG to rule out metabolic acidosis, and there is urine to rule out to detect the ketogenic body. Then state additional any 3 investigations. Sorry, I forgot to write it. Investigation for the management of the patient with justifications. So we expecting any one of these 3: blood CS to rule out infection, serum electrolytes to rule out electrolyte imbalance, especially hyperkalemia, renal profile to rule out AKI, and to rule out DIC, this one. At this point, actually, we have a debate between our mates. So I wanted the question completed with diagnosis, then pathogenesis, then investigation, and followed by the management. Okay, but since that I wanted to ask that what are the investigations will be provided for the management, then I supposed to ask this one, that discuss the principle of the management this patient. But my mate says that no, they ask first that what is the investigation for the confirmation diagnosis, what is the investigation for the confirmation management for the management. It doesn't necessary that it should be always we should ask the treatment. So I did it, but I decided, I told them that I'll ask the moderator that what should be the ideal way. Thank you.
Okay, now it's open for everybody. Anybody want to comment on that? Any member want to comment on that?
So the problem with such type of questions is that they are sequential. And when they are
Right.
sequential, then marking is going to be difficult. If the student gets the diagnosis wrong, but the signs are given and can explain them on the basis of pathophysiology, they would still pass the question.
Right. Okay, we will address that. We will address that. That's a very, very genuine issue, especially in short essay question. Anybody has any other comment about that? Okay, let's say this group and Prof. Kabir, if a student gives a different answer for your question 1, would that change?
Yes, I'm hearing, sir.
So let's say rather than DKA, they may say something different.
Yeah,
They say
they will get.
So would the subsequent questions be affected?
Not really, sir.
And let's say state the mechanism of following conditions, low volume rapid pulse, okay, and the
So first,
hypotension and fruity odor in the breath and shortness of breath. So you want them to give the mechanism without relation to the diagnosis.
Sir, first one is, sir, even they diagnose. First one is, sir, so many clues are here there given, sir. You see, type 1 diabetes.
That doesn't matter. That doesn't matter.
Okay.
They still somebody
Sir,
might say, okay, it's a diabetes with severe dehydration.
So you see, the hypotension, it could be due to I mean, that and if they you want to say that is it dependent or not dependent, right? Yes,
Yeah.
some extent this is dependent. Question 2 is dependent on right?
Right.
Some extent. But
Right.
if if someone they said it could be acidosis due to other than decay, right?
Right.
Is there is some hypotension or some dehydration, some other way, other
Right.
than diabetes or any other causing that he's then dehydrated. So based on that one, they can answer these ones. For dehydration, there could be tachycardia, hypovolemia, causing tachycardia, low volume pulse, right? And dehydration also may cause hypotension, right? This one can. So in some extent is dependent, but in other way also, in other way they can explain this one, right?
I think Dr. Aisha was raising the same point. Let's say no, here, for example, hypotension here, right? So,
right.
So in the scenario, you have given a blood pressure.
Yes.
And the hypotension, you are interpreting it.
Yeah.
So you are not allowing students to interpret. You are interpreting yourself.
Yes.
So actually it should be is hypotension a component of DKA?
You means yes, I should write this low blood pressure.
Yeah, and if you, because we cannot interpret for them.
Maybe we can ask justify your answer in one.
Hypotension is, sir, hypotension is not a component of decay.
Sorry, I'll come back to Noor Haslina of us, but here, if you have given the blood pressure, either you can give in bracket the normal range, so students can pick up that this is low. Otherwise, you are interpreting. So That's one. And so, yeah, Noor Haslina, you were saying something?
Yes, Prof, because you mentioned that instead of we interpreting for them, so can we just ask them to justify uh he or her answer in one, so then they can explain about the related with the fruity or the smell, everything's, and related with the mechanism of the disease.
Right. No, that's right. Let's say if we ask them to give the most likely diagnosis and justify, so they might mention there, but that's what I was asking Prof. Kabir, is hypotension a feature of DKA, or you can have DKA with normal blood pressure as well?
Sir, decay is a condition where there is a profound dehydration, and the hypotension is due to dehydration.
Right.
But the hypotension is not directly. Understand? Hypotension, sir, you see, the hypokalemia may be complicated. Hypokalemia may be complicated assistance, then we give cardiac, I mean adrenaline and other things. But adrenaline and other drugs, these drugs are not the treatment of hypokalemia. So it's like that. The hypotension is
I mean,
not the component of decay.
right. So actually, the
And sir, you see,
scenario is quite good.
sir,
Scenario is quite good, and
sir,
as you
I have
said,
a,
yeah,
sir,
scenario,
I just want to say, sir, this
right.
question, I mean, in SAQ, MEQ, whatever, we are testing the students' cognition, I mean, knowledge, sir, right?
Right.
So you see, in MCQ, we are giving the blood, I mean, any lab value as well as we give the normal range.
Right.
Here, we are giving a scenario. We are giving a scenario, and patient actually not allowed to go for the management of decay in the real patient in real life side.
Right.
Our students.
Right.
So you see the hypotension and the pulse rate. I'm giving this one.
I agree with that, but only thing is that we should try not to interpret for students.
Okay, sir. Okay, sir.
So they should pick up themselves rather than we interpret for them. And as you said, there is some degree of dependency, which I think can easily be addressed. Can we go down? Go down.
Okay.
Again, let's say the signs and their mechanisms. We are asking without linking to the diagnosis. Is the same like there?
Why, sir? Because the first one we have given the diagnosis, right, sir? The first questions.
Yeah, that's why I'm saying that if a student makes a different diagnosis.
Sir, if they mistake different answers, they will get wrong. They will get zero. Because, sir, this is a scenario, sir. We want
that's right. But then
I'm saying, sir,
then
I mean, sir, dependency, sir. Dependent question will be automatically come in the MEQ and SEQ because we are
it wouldn't.
giving.
No, it wouldn't. It wouldn't. For example, if in the above scenario, we at the end you add one line that the patient is suspected to have DKA. So means that you have indicated the diagnosis, then your first question would not be asked, but all subsequent questions would become very valid. The problem.
But if I ask, sir, if I just tell them a suspicion of the diabetic ketoacidosis was done or is done by the clinician, then the level of the question you see, sir, if the level of the question will be I'm just, then it will be just all the answer and question will be standalone that I am asking
it wouldn't stand alone. Once we say that we suspect the diagnosis of DKA in this patient, then they have to explain the low volume rapid pulse in relation to DKA. They have to explain the fruity odor in respect to DKA. They have to explain the shortness of breath. You see, problem with the SEQ is, the big problem with SEQ is dependent questions. Now, for example, if you go to the last one, the management one, go to the last question, the management one. No, the question.
Question is discuss the principle of management of this patient.
No, okay. Now, if students make a wrong diagnosis, then how can they discuss the right management?
They will get wrong, sir.
No, so
They will get
this means
divided
that,
zero, sir.
yeah, this means that you are penalizing.
I am that test.
No,
I am
Kabir,
here to
listen,
testing their
listen.
knowledge, sir.
No, then listen, then you are penalizing the students multiple times for one mistake. The student make mistake once, but you are penalizing it multiple times.
Of course, no, sir. I have given type 1 diabetes
No,
mellitus.
you
I
think,
have given.
yeah, Prof. Kabir, you think that 100% students would write DKA?
I
No,
didn't,
answer
sir.
that
I
question.
didn't.
Answer that question. You think 100% students would write DKA?
100% student also cannot write the answer. So if I even given the provision of the suspicion of the decays.
But that would not be your
Understand,
fault.
sir?
That would not be the fault of the
I mean,
examiner.
if I even given this as
No, that would
that-
not be the fault of examiner, because you have already told them. But here, as you say that not 100% students would give the answer of DKA, so we cannot penalize them more than once.
sir, if I don't raise this one in the question,
Hmm.
the type 1 diabetes mellitus, right?
I'm not disagreeing on that, Prof. Kabir. I'm not disagreeing on that. What I'm asking is, for question 1, you think 100% students would write DKA?
Of course, no, sir.
Yeah,
Of course, no.
then this means that some student who writes it wrong, they would get 0 for the whole question. So
Why not, sir?
huh?
Why not, sir? Why not, sir?
No, that's not
Because
fair.
this has got they got in our
No,
curriculum. They got
that's
sir.
that's
There's
not
got
fair that
lectures, sir.
that's
No,
not
what
fair.
I'm saying.
That's not fair that you penalize the
No,
student.
why I'm giving, sir?
Hmm.
This topic has got lecture. There's got
No,
TBL.
that doesn't
Also
matter.
PBS,
That doesn't
that's it.
matter. That doesn't matter. You yourself are saying that there would be some students who would not give the answer of DKA. So, okay, they get 0 for this, but they would get 0 for subsequent questions as well. So
Right.
there's the inherent problem with SEQ. Yeah, so if you do that, then you can modify your question and you would be asking, let's say they have to explain everything based on, let's say, you say the
Then,
food.
sir, I mean, sir, then why a patient with this one come this one, then second one I'm putting this one. Okay,
Yeah,
I mean
that's
look,
that's the presenting complaint. That's the presenting complaint, and this is your provisional diagnosis.
Just I'm giving, sir.
Yeah.
After this para, I
Yeah.
just give this one.
No,
Okay.
no, but then you cannot ask the other question unless you give the information.
Okay.
How would you ask about hypotension if you don't give the?
I said that they state the mechanism of the following condition that found in the patient.
No, then you have to give that information in the scenario and then ask. You cannot.
Or if I ask, sir, what are the sign will be? What are the sign will we get in this patient?
You cannot add new information in the question. You can add information in the scenario, but not in the question. Question has to be based on the scenario, and that's not your fault or anybody's fault. That is the drawback of SEQ. That unless we give some indication of a diagnosis, otherwise it becomes totally dependent questions. Yeah, any other views from any other participant, please?
Sir, in such cases, when we are marking the first question, the provisional diagnosis, the marking key should elaborate that if the answer is not exactly DKA, but is any other of differential, how many marks can be allocated, And when can we mention that it will be totally zero? Because 2 marks have been given. So it
Right.
cannot be, it cannot be a checklist. And the other thing is, if the provisional diagnosis is the key element that we are capitalizing in this question, then
Right.
enough marks should be given to this component that even if they answer the rest of the questions, the competence level of that student is determined accurately.
Right. Basically the SEQ is very good at asking, for example, at pathophysiology, at the confirmation of the diagnosis. You cannot ask management unless you confirm the diagnosis, although you can ask for the suspected diagnosis. If, like Dr. Aisha is saying, if you want to give sequential marking, then you have to write here, okay, DKA 2 marks, but what are other possible diagnoses? You have to make a list and give a diagnosis. Like the example I showed you, where even we write that if answer is, in that example was space occupying lesion or abscess, the no marks would be given. So that is possible. But major issue in SEQ is this subsequent questions which are dependent. So that create a problem.
Sir, I have a question, sir.
Right.
It means that in SEQ, as per the things, that SEQ would be finished, should be finished with this kind of phrase, right? A provision
Yes,
of this
they-
diagnosis put it, right,
yeah,
sir?
yes,
Okay, sir. Then
it has to be. It has to be.
then
Hmm.
there is no chance to ask this question, right, sir?
Yeah, the first, you may not ask the first question, or you can ask, okay, suspected is DKA. So what steps or investigation you would do to confirm it? The diagnosis, or what signs you would look for to confirm that? So, because you have to have a
Understood.
focus of asking the questions. Right? Any other comment from any other participants, please? So we need to remember that in SEQ, the dependent question or subsequent question is a major issue. And when we are constructing these questions, we need to give some indication that what condition we are talking about. But this may not be needed in MEQ until we go for management. Okay.
Sir, one more, sir.
Yeah.
Do you want that? What the comment about this one? That my group mates wanted to finish with this up to investigation. No need to ask about the management. But I said we
Yes,
should
I
complete
mean,
the whole things.
We discussed, it all depends upon the objective. What is the objective of your question? Let's say if you want, for example, if year 5, you might be interested in going for management. Whereas for year 3, you might end up with investigation, etc., or pathophysiology. It depends upon the situation. Both are correct, but depends upon the level of students.
It was made for the year 5 students. Then
Yeah, so normally for year 5 students, we would include at least the principles of management. Right. Okay. Thank you very much. Can we go on to room 2?
Thank you, my mates.
Prof.
Thank you, sir.
Prof. Kabir, you have to stop sharing for this so that
Yes,
room
sir.
2 can use that. Room 2, please. Who is the
Okay, Prof,
spokesperson for room? Sorry.
I will share it, yeah.
Sure.
Okay. Share screen. Okay, can you see my screen?
Okay. Everybody can see. Can you make it a bit bigger, please?
Is it okay?
Yeah.
Okay, so from the scenario, this is a scenario that given through the WhatsApp, and then it
But
asks us.
this is the one which I sent, right?
Yes, yeah. From this scenario, right?
Right.
Okay. And then from this scenario, we have to.
Copyright, sir.
Pardon?
Hmm. Yours is room 2, right?
Yeah, room 2.
So room 2, you have to write the part 1 of MEQ, right? Okay.
Okay, the MEQ part 1. So the first question that we can ask from the scenario is state a few differential diagnoses according to the scenario given.
Okay.
So there are a few that maybe we can, not a few, if let's say exam question, we can maybe put 3 or 4 differential diagnoses, ask them to state.
Right.
And
Yeah,
then-
that's important that we should use the number. Because when we want to have a marking scheme, we must have a number. Let's say you want to say 3 differential diagnoses and you want to give maybe 1 mark for each. So the number is important for the objectivity. Okay.
Okay, 3 marks.
Mhm.
Okay, and then we created 4. Maybe I will go for this. The 4th one, is it okay? List 4 diagnostic tests that would lead to the confirmation of your diagnosis.
Right.
Or others will be give your diagnosis based on 2 clinical findings in the examination and list them to support your diagnosis. Based on the scenario, and your diagnosis, state the clinical presentation that you may find on the boy.
Right. Okay. Now, any comments from the participants, please?
Sir, I'm Dr. Kalam from Group 2, Room 2.
Yes, sir.
So, sir, actually, it's a good one, but we have a backup scenario as well, which for the task that you have allocated.
All right.
If you allow me to, we can bring a fresh one as well.
Yeah, sure. Let's quickly do this, then we would look at that. Now, the state 3 differential diagnosis.
Sir,
based on
I have.
Yes, Dr. Kavi. Yes.
Okay, sir. These 4 questions, among these 4 questions, 3 questions belonging diagnosis. To me, student will be confused.
Right.
One is differential diagnosis. Okay, fine. Then give your diagnosis based on 2 clinical findings. Definitely, they put the number 1 answer based on the clinical findings. Then, based on the scenario and your diagnosis state clinical presentation. I mean, question 2 and 3, sir, is one is based on the your diagnosis, clinical finding, 2 clinical presentation. To me, student will be confused with these questions. That's
all right. Okay. If we accept the first one, state 3 differential diagnosis, according to the scenario given, what should be the next question? Which should be the most appropriate question after this 3 differential diagnosis?
Ask something what you will ask in the history with reason.
Right.
What you may ask in the history in the reason. Then next question could be what are the based on your diagnosis, what are the expected clinical findings you may get?
That's right.
So we can ask that in the first question, the 3 most likely differential diagnoses. It should not be any 3 differentials.
Yeah.
It should be based on a likelihood. And then next we can ask for how to confirm each of these differentials through investigations.
Yeah, basically that's what Prof. Kabir is also saying. We can ask that for each of the differential diagnosis, list 2 questions which you would ask in the history. For example, if you are thinking of dengue, what other information would you like to get? Or you are thinking of typhoid. So you can ask for each of the differential diagnosis, state 2 questions you would like to ask in the history. Or you can also ask that for each differential diagnosis, list 2 investigations to confirm the diagnosis. But then here we have to cover all the possible differential diagnosis in our model answer. so because students, for example, you have given here 5 and you are asking for 3. So your model answer must cover all the 5 differential diagnosis, because student may choose any. So your model answer should be quite elaborate on that. So first asking the most likely differential diagnosis, then asking, let's say, the 2 relevant questions about each differential diagnosis, or maybe, let's say, 2 investigation for each differential diagnosis. So you are relating it to the patient, you are relating it to the differential diagnosis, but here model answer should be quite elaborate. And once the exam is over and you are marking, the student might have written 1 or 2 differential diagnoses which were not in your list, but they are reasonable differential diagnosis. So in that situation, we have to modify our model answer.
Prof, can I ask something?
Right.
Okay, when constructing this, okay, the first, second, and third question,
Right.
if from us, Dentistry UiTM Malaysia, this is pato, we are covering the pathology part.
Right.
Because we are integrated, so in one MEQ question, we integrate between normal and abnormal subject.
Right.
So, what is it you have experienced this, Prof? Because if me, looking at this scenario, so what we usually do, we will put question number 1, for example, anatomy will cover the question number 1. So we'll give 2 or 3 questions regarding the anatomy. And then
Right.
question number 2, it will be the pathology. So this can be, these 3 questions can be from the pathology. And the
Right.
question number 3 from the pharmacology. But maybe we have to include a bit of add on the stem here, the scenario, by putting on about the treatment. So pharmacology can come in and cover the 3 parts. What is your do you
Yeah.
have experienced this, Prof?
I think that's good, because the MEQ is supposed to have multiple parts.
Yeah.
So if, for example, you have part 1, part 2, part 3, and you want to, for example, bring the pharmacy or pharmacology, then before that, we have to establish the diagnosis before treatment is given.
Yeah.
So you are absolutely right. In fact, this is what we do, is that we check the pathology, pathophysiology, the mechanisms, and then the investigation, and then we establish the diagnosis, and then we ask for the treatment. Even you can ask for the adverse effect. Let's say you ask the student, for example, in a particular situation, you are asking for, let's say, what treatment you would given, or pharmacological treatment you would give, and give one side or adverse effect of each drug you are going to use. Yeah, that's absolutely fine. That's absolutely fine, because MEQ is best way to assess the integrated system.
Prof, one more. I want to ask, okay, this is, for example, this is one scenario, and then before, let's say, the pharmacology question come, we will add on another smaller stem. This patient were given this drug, and then we come out to the question that, can you please state the pharmacokinetic of this drug or anything? We have to.
That's right. That's right. If you look at the MEQ I sent you as an example, you would see that subsequent parts have additional information. So we give additional information and we ask additional questions. Let's say you can say that the subsequent part, okay, this patient was treated with penicillin, for example. And then you can ask the rationale for using penicillin in this patient. You can ask the adverse effects, or you can ask the mechanism of penicillin in treating that particular organism.
Okay.
Yeah.
Prof. Malik, can I add something?
Yeah, sure.
In Malaysia, because Nurhati is from Malaysia, so she's giving her experience over here.
Yes, Prof.
In preclinical years, we make the questions from the preclinical subject aspects. the disciplines which are covered over there. So
Yeah.
they definitely starts with anatomy, go to either biochemistry or physiology,
Yes.
then they go to pathology and then to pharmacology.
Mm-hmm.
And a component of community medicine is also added because these are the main subjects which are taught in the preclinical years, and they are the learning outcomes, and we have to cover all those learning outcomes. So the questions will be slightly different from a completely clinical scenario as they progress, because then we are telling them what the slide shows, or what was the pharmacological treatment which was given, and then we ask the question about the mechanism of action of that drug or something like that in that scenario. So diagnosis, we will not ask the student to come to the diagnosis. Diagnosis we will give to the students. Right, Nurhayati?
Yes, yes, Prof.
Okay, thank you.
Rob, I have a concern about that
Right.
kind of
Right.
integrated questions, right?
Right.
So you said that if let's say they are dependable, so it's
Right.
like kind of the meaning is that if let's say the first question is about the anatomy, pathology, and it's already the first part is already like mislead the other part. All right. So how is actually we try to avoid this kind of
No,
penalizing the student?
not really, Raslina. What we do is that the questions we ask in the first part, we would provide some of the relevant answers in the subsequent part. So the beauty of MEQ is that even if the student has given wrong answer in part 1, they will the information given will pull them back to the right path in the part 2. That is the major strength of MEQ. So even if they have made mistake in part 1, they can still do well in part 2 based on the new information given.
Okay.
Yeah.
But from our experience, Prof, it
Yeah.
will like from the beginning, if let's say they already start to like, I'm not sure whether the student have setting their minds, this is a kind of the problem, and then it's related with the other but maybe it's as you mentioned, the way that we construct the questions must be actually helping them to make sure that they can answer better in part 2 and part 3. So
Yeah,
that will be the
yeah, that's right.
challenging lah.
Now, for example, in part 1, I asked what investigations would you do? So in part 2, I would say that these investigations were done and these are the results. So even if student has given a wrong answer in part 1, in part 2, they are told that these are the investigation that has been done and those are the results. So this is the strength of MEQ, that even if the students have not done well in part 1, they can still go do better in part 2 because the new information is being provided. And that is also a reason why the students are not given access to the answers they have already submitted, because they can change that based on the new information.
Prof, can I ask, is it a must that we have to separate part 1 and then they have to submit first and then they continue part 2? Is it a must?
Yeah, it is must, because part 2 would have some answers to the question 1.
Okay.
Otherwise, they would change because
Yeah, I understand that, because we are doing it as a booklet. So
yeah.
they can anytime go back to the first question if
Right.
let's say we construct a question like
Yeah,
this.
and then they can change. Yes, that's
Yeah,
right.
yeah.
That's right. Yeah.
Okay, thank you, Prof. Can I stop sharing?
Okay.
Okay.
Any other comments? Any other questions? Okay, can we
Okay.
go on to room 3 then, please? Who is the spokesperson for room 3?
Hello, yes, it's me.
Yes, please. Imandur. Yeah.
Yeah.
You
I'm
can
not
share
familiar
your,
with sharing screens, but I will try.
yeah, it's you everybody can share the screen now. Yeah.
I'm not sure if you can see my screen.
No, do you see a green button on the bottom? Green button with arrow?
Yes.
Yeah, you click that.
Uh-huh.
and then you see your presentation
Um,
on the screen.
yes, I see it, but
Yeah, just press the button of share. It's written share there. You press that button.
oh, just a second. It's giving me too many options.
No,
And then it
this
says
should be
that I
written-
should open my system settings. So
Okay. Is anybody in the group can help?
I'm trying.
Yeah. Anybody in the group can open, and then Imandur can present.
Actually, I'm the one who has the file. So
Oh, right, I see.
Can you share your file in the WhatsApp group and we can then
Yeah.
download it from there?
That would be good as well. Yeah, you share the
yes,
file in the
yes.
WhatsApp group.
Yes, just a second. I will do that. I'm sorry, it's taking me a long
Oh, no,
time.
no, it's all right. It's all right.
Sir, in the meantime, can we share the one from room 2? We made the
Yeah,
second one as
please go ahead. Please go ahead. Yes. Yes. Sorry, I forgot about it.
I'm so sorry.
Yeah,
I'm
please,
so
yes.
sorry because I had a power outage, so my laptop broke me out of
Is it visible,
WhatsApp.
sir?
Sorry, I will do that.
Okay, while Imandur is doing that, let's look at the this question being posed here, the modified essay question, part 1. Okay, please go ahead.
Sir, being a surgeon, so I selected it from my clinical scenarios.
Okay.
So the part 1 is the 65-year-old emaciated female patient presented with a mass in right hypochondrium of the abdomen.
Okay.
And she also complains of pain, right hypochondrium, which was on and off in nature. She has no history of liver disease and she is non-alcoholic.
Okay.
On examination, she has yellowness of eyes with lemon tinge. Her pulse is 104 per minute and blood pressure is 110/70. Scratch marks are visible all over the body. And on abdominal examination, there was a palpable mass in right hypochondrium, which was non-tender, and spleen is impact. So this was just the scenario.
Okay.
So we kept it simple and list the 3 questions to ask from the patient and give the rationale for each question.
Right.
We put 3 marks for it, and the questions listed are the history of fever first, and the rationale for this is to know about the sepsis, infection, and cholangitis, which is obvious in these cases. Secondly, the history of itching that points out towards the obstructive nature of jaundice in these patients. And third one is the history of weight loss regarding the age of the patient and emaciated nature. It will point out towards the malignancy. History of bleeding, which is due to deranged bronchoambient time in these cases. And last is the history of change in stool color. So clear colored stool, that would be the answer probably from the patient.
Right.
And so these
So
are
let's look at this first, Dr. Khurram.
okay, sir.
Right. Okay, now all your questions are related to differential diagnosis,
Yes, sir.
right? So
Yes, sir.
it would be good to ask that, let's say, list 3 most
Differential
likely,
diagnosis.
yeah,
Okay.
list 3 most likely diagnosis, and then ask 1 or 2 questions in relation to each differential diagnosis.
Okay.
Because here, although you are asking questions based on differential diagnosis, but student may not think in those terms.
Okay, sir.
Yeah, so it would be good to, otherwise it's excellent. It's excellent that we asked, let's list 3 differential diagnoses, and for each of the differential diagnosis, ask 1 or 2 questions. So that would be very good approach here.
Okay. And
Because your questions themselves are indicating differential diagnosis.
okay.
One small comment over here, Prof.
Yeah.
Khurram, you have written in the blood pressure is 110/70.
Yes.
I think we should make this a habit that when we present these figures to the students, we should give the unit of it as well. Na? MMHG, if you write, then the student will know that it is always written over there. Otherwise, they will, pulse is 57 or pulse is 73. They just write it like that and they can go away with that one. So to make them write a good history, your questions should also be a source of teaching for them that how they should be writing the history.
Thank you, ma'am.
Thank you.
For pulse, I have written 104 per minute. For blood pressure, I found.
Yeah.
Thank you very much for that.
Yeah. Okay. So next
Sir,
one.
Sir,
Yeah.
regarding the questions, the question,
Yeah.
the question, we should have some, question should be more scientific. You see, if we put one diagnosis is obstructive jaundice, pulse will be never tachycardia. Rather, it could be bradycardia. So these small things and the questions, the palpable mass, I think something more, the consistency, tenderness, non-tenderness. In the MEQ, it should be a bit elaborate to come to the differential diagnosis for the students. That's my
Right. Now, Prof. Kabir, yeah, you are right, but we have to also keep in mind the time. So what we want to do is we write the most relevant things there, and and avoid long details, because then student would spend too much time on reading that. So you are absolutely right that we should give the information, but it should be not too much, and mostly the most important points must be mentioned. The trivial information may not be. So relevant information must be there. Otherwise, the question would become too long and students would spend too much time in reading alone.
Thank you, sir. And another thought process behind this is that there are 2 or 3 clues. So problem solving or critical thinking would be addressed.
All right.
If you give a clear-cut, hard inconsistency, not movable, fixed, so that will directly points out towards the diagnosis.
Yeah, that's right. Actually, the MEQ, we start with the broad base.
Yes.
We give a scenario where they have reasonable number of differential diagnoses. If we give the scenario too specific, then thinking of differential diagnosis becomes very difficult. So it is like a pyramid that we start with the broad base and slowly, gradually we come to the diagnosis. Having said that, at the same time, we should give the most relevant findings there. We should not expect students to make decision on irrelevant information.
Sir, is it necessary to have a broader aspect and in the first question and then proceed? For example, in my branch, I deal in dentistry, specific prosthodontics. It is the replacement of the natural body parts and the teeth with artificial ones.
Right.
In my subject, there is no broader base. If I put a specific question, and if I give a specific arch form or a diagram, they have to be specific on the diagnosis. I cannot, extend a broad differential diagnosis type thing or something of that sort. It is relevant to clinical conditions, yes. For example, if there is a pathology or something of that sort.
Right.
But if I am going for a treatment plan,
right,
giving it a patient with regards and then, asking them to come to a conclusive diagnosis and then, to progress.
Sir,
treatment plan.
my point is that we cannot ask treatment unless we have come to a diagnosis. So
Yes,
we
sir,
have,
but my question is that you said that question number one should start from a
Re-
broader perspective and then pyramid down.
you are talking about dentistry, is it?
Yes, yes, sir.
Yeah, unfortunately, our knowledge is very poor in dentistry. But for example, I can think that a patient comes with, let's say, presenting with swollen gums and bleeding from the gums, right?
So no, so this is which the question that you are asking,
Mhm.
it has a broader base.
That's what I am saying. That's
That
what
has
I'm,
a broader base. But
yeah.
if I consider my subject specifically,
Mhm.
I would ask that the patient came to the clinic.
Right,
He had missing this number of tooth.
right,
And the arch and the residual ridge was such of kind, and the mucosa was of this kind, and everything of this sort, right?
right.
My first question would be,
Mhm.
if it's related to partial denture, my first question would be,
Mhm.
give me, classify the arch as per Kennedy's classification.
No, that question would not be related to the clinical scenario you are giving. You
No,
are
that would be related to the clinical
no,
scenario.
because you can ask that the way you are asking that question, you can ask that question without giving scenario. The way you are asking the question, actually, you don't need a scenario to ask that question. You can straight away ask that question.
So how?
Do you follow my point?
No, sir.
No, let's say, what's the question you are saying?
Sir, may
And just read the question, please.
so the question is quite lengthy, but
No,
okay, I'll share with
just
you.
let him, okay. Only question, not the scenario, only question.
So the question is, okay, based on the scenario given above,
Right,
or the picture above,
right.
uh, state, classify the arch as per Kennedy's classification.
So classify the arch
As per Kennedy's classification.
as per candidate classification.
Yes, sir.
Can you ask this question without giving the scenario? Classify the arch as
No,
per
sir.
candidate? No, I mean, in theory, can we ask the question, classify the arch as per candidate classification?
No, sir. We
Mhm.
have to give particular knowledge and information so that the student can come to the conclusion that this is the actual classification of the arch.
Right. So basically, sir, you are asking them to implement to apply their knowledge to make a diagnosis for that patient.
Yes, sir.
Yeah. So the and you think that every student would give the same answer, or they can give different
No,
answers?
sir. They can't give a different answer. They have to
Right.
give the
So,
same answer.
so that different answer would be the differential diagnosis.
So there is no differential diagnosis. You cannot give a differential diagnosis in this case.
Yeah, but then sir, that MEQ may not be the right method to assess that, because every assessment method has its limitations. If the answer is so straightforward and answer is so strict that no other answer is possible, that is not the right topic for MEQ. So
Okay,
that should be assessed by other methods, not by this method. Because
sir.
yeah, MEQ, as I said, we usually start with the broad base with differential diagnosis, because we want to assess students' ability to interpret and critical thinking. If there is no critical thinking, simply recall of knowledge, then MEQ is not the best way.
So there, in the sense that you are talking about the differential diagnosis, in my case scenario,
Right,
it would this type of thing would reflect on the treatment options or the design of the removal partial denture, which
right.
student has to give to the patient.
Right,
The design scenario
right.
can be different based on their knowledge and the application of the components of RPT.
Oh, right, I
That can
see.
be different,
Right.
but the diagnosis will be specific.
All right, yeah, because sir, issue is that at least my knowledge in dentistry
No,
is
no, no, no,
Yeah.
not a problem, sir. I'm
Yeah.
just I'm just telling you that this is the scenario in my branch
right. Yeah.
that
So
I can ask them a diagnosis which is classification which cannot go haywire. That is particular to it.
yeah. So then
But the
actually
treatment
that
of-
might be tested in other formats rather than MEQ.
Yeah, but the next question that I could ask is,
Hmm.
what will be your removal partial design
Hmm.
for this scenario?
All
And the
right.
student can, creatively
Hmm.
make up different types of designs
Right.
based on scientific reasoning.
Right.
They can make up a lot of designs. For
Yeah.
example, they can
Sir,
use a lot of major connectors or RS or whatsoever they want to
Sir,
do.
is it possible that in scenario you give the classification yourself
Okay.
and then ask the students the way you are asking the how they would approach with different designs? Is that possible?
It is possible, but in our scenario, we usually need to. Okay, right. Okay, I give the diagnosis and then I ask the different designs or what
All right.
parameters.
Yes.
Okay.
Like we were talking about that SCQ, we give a scenario and then we say that we suspected DKA. So
Okay.
you can say that we think this is the diagnosis and then you can move forward from there.
Right.
All right. Okay, thank you. That's great. Okay, yeah, the room
Yeah, I
3.
sent the room 3 assignment
Okay.
on WhatsApp.
You have sent in the WhatsApp?
Yes.
All right, okay. Okay, let me check on that. Okay, I can see that.
Okay. Yeah.
Okay, we can see that.
Yes.
Yes,
Okay,
I
great.
shared it.
Okay.
Okay, first of all, MEQs, I'm not familiar with MEQs at all. This is
Right.
my first encounter, and it was quite difficult. and now, as I'm presenting it, I'm having other questions in mind that I would have put instead of the questions
No,
we formulated as a group.
Yeah, that's how we learn. That's how we learn. So,
Yeah.
This is the part 1 which I have sent.
Yes, exactly.
Right,
And there are 2 small questions at the end
right.
that started with the lab investigations with some clues.
Can you go on to part 2, the one which you have prepared?
Yes, it's down. You can do. You can scroll down.
All right. Okay.
Okay, that you can scroll more down.
All right.
Okay, the given information was the further lab testing that was ordered for this child. Actually, it's not just lab testing. It's lab and sonography. and CBC showed leukopenia, and coagulation profile showed prolonged prothrombin time, and the ultrasonography showed splenomegaly.
Okay.
The first question, I would have formulated another question, which was list causes of hepatomegaly and splenomegaly. For example, this is not what we did as a group, because
Right.
the time was tight, and we had flight of ideas.
Right.
But actually, the question that we formulated was list 3 further testing that you would like to add with their justification.
Okay.
And we set 3 marks for this question.
Right.
We expect the student to answer as liver function tests to exclude hepatitis, fibrinogen and fibrin to exclude the DIC, and a platelet count to exclude thrombocytopenia, as the child has petechial hemorrhages.
Right.
And then based on your finding, which is your provisional diagnosis, I don't think this part of the MEQ, now that
Yeah, but because
I-
yeah, you're right, because here, based on your findings, basically this can go to the part 3 after we
yes, exactly. Yes.
yeah, after we have given the results, because otherwise it would be the same issue which we were discussing previously, that if
Yes.
student interpret the investigations wrongly, their provisional diagnosis may be wrong as well.
Yes.
Yeah.
Yes.
So what we do is that after this part 2, we go to part 3 and we give the results,
Yes.
and
Yes.
then we ask the provisional diagnosis. Yes.
Yeah, the full results.
Yeah, that's right. That's right.
So that the student does not miss the diagnosis.
That's right. That's right.
Yeah.
Yeah.
But on second thoughts, the number 2 question can be switched for list so and so causes of hepatomegaly together with splenomegaly.
Yeah, in this particular patient.
Yes.
In this particular patient, yes. Mhm. Or that can also go after diagnosis. Let's say once you establish the diagnosis, then you can ask what is the mechanism of, for example, splenomegaly or hepatomegaly in this patient.
Yes.
Yeah. Yeah. Any comments from other participants? Any other comments, please? If none, can you stop sharing, please?
Okay, you stop sharing.
Sir, after the investigation, asking the provisional diagnosis, or after the investigation, should ask the confirm the diagnosis. What is the confirmed diagnosis or complete diagnosis?
Yeah,
Usually we ask provisional diagnosis before the investigation. That's I just maybe.
Right. Yeah, that's right. Because once investigation are provided, then we ask the confirmed diagnosis, not provisional diagnosis. Right. Any other comment by anybody? Any participant? Please switch on your cameras, your videos. Actually, it's already 5 o'clock, and we. I think your discussion was really quite absorbing and engaging, and we discussed so many things. So the last part was about the marking schemes. I don't think that would be possible now, but what I'll do is I'll send the slides to you, the whole copy of this presentation, the PowerPoint, and actually the last about 20 slides or 25 slides are on how to mark, how to get the model answers, and how to mark these essay questions. And there are some important points given there. For example, I can say that we should mark question by question rather than paper by paper or student by student. Means if we have 20 students, 20 papers. So the first we should finish question 1 in every paper and then go to question 2, because in that way we can compare the students from with each other, and we would not be biased, right? And the second important thing was that you should be in good mood while you are going to mark these papers. Must have a cup of coffee and a good chat, because if you are angry, the student would suffer, right? So there are some points in those slides I will send to you, and then we will maintain this group for a while.
Yes,
So
please.
if you have any other questions on that, you can pose the question, and each one of us can actually give a comment. So let's keep this group on for another week or so, and we pose the question and we answer and give opinion on that. So keep this group active for another, let's say, 1 week or so. With that, is there any other comment before we close this session?
Yes, sir.
Yes.
Why we always fail to convince or happy medical education department during question vetting. Even I personally put their vetted questions, maybe 3 years before they vetted question, they also vet their
You see, medical education department is such a poor department that everybody who is angry with somebody else, they blame, they blame medical education and make them target. I don't know, right?
So there's another problem,
Right,
which I usually feel with the medical educations.
right.
So sorry. But since you are a clinician yourself, so you might understand the fact,
Right,
you know, the problem arises when a pure medical educationist who has not gone through, the training of being a specialist or something of that sort,
right.
dictates a clinician or the basic sciences guy, okay, this is the way that you should
No,
do it, and there's nothing else you can do.
Dr. Mateen, when you say pure medical educationist cannot be pure unless they work in the field.
So, but that is the problem.
Yeah,
Mostly, if you say that from bachelor's, they directly go to the medical education, and then
we have to work on that. A medical educationist who is sitting in the office only without dealing with the students, without involved in teaching and examination, they don't know what they are talking about. So when you say pure medical educationist, that must be somebody who obviously has basic degree in medicine, who has done some training in medical education, but they must be working with the students in the field. Only then they would understand. That is a big issue, and you are absolutely right in that. Luckily, here we have our medical educationists who, like myself, I'm a pediatrician, so I'm working in the hospital. I'm working with the students, so we understand what's going on. Similarly, for example, we have medical educationists. They are teaching anatomy or biochemistry. So that's important. You should actually promote this, that the medical educationists should contribute in other academic activities. Only then they could be really good medical educationists. Right.
thank you.
I think with that, we come to end of this session. I really want to thank every one of you. I enjoyed your discussion. It was a good 3 hours we spent, and have a lively and interesting discussion. And as I mentioned, please keep this at least for about 1 week. If you have any other questions, pose that, and I will send, I think in next maybe 1 hour or so, I'll send the whole slides to you. So you can go through that.
Thank you.
Can we
Thank you so much.
take questions and send it on the group for critique?
Sorry?
Thank you, sir.
Can we make like MEQs or something of that sort of questions and send it to the group for critique purposes?
Yeah, that would be good. That would be good. Yeah, let's do that. Yeah, let's do that. We
Yeah,
always,
a positive critique would be good to, you know,
yeah,
enhance our.
we always learn from each other. We always learn from each other. That would be good. Right, thank you.
Yes, can we know?
Thank you so much.
Can we know when the future workshop will be?
I'll let you know in the group.
Yes.
We usually have once a month.
Okay.
Right.
Thank
Can
you
we
so
still
much.
extend this workshop for another week?
Means
Means the remaining part, can you do it the other week too?
you go through the slides first, and then if there is a need, we can meet. I hope the slides are self-explanatory, but if you are otherwise, you can pose questions in the group as well. Right? I